The ones who help us in some of our most difficult times, and now they're coming under attack almost daily. Only on 4 tonight, our Alexis Zotos reports on violence against healthcare workers, how it's forcing many out, and what some St. Louis hospitals are doing to stop it.
3 St. Louis area nurses with decades of experience.
I've worked in the emergency department for over 30 years.
I've been a nurse for 27 years.
For 20 years, I've been an emergency room nurse.
And they all have the same experience shaking so many in our hospitals.
I've been pushed up against the wall. I've been bitten. I've had things thrown at me.
Just this week, we've had one patient that has assaulted 8 of our nurses.
Almost exactly 2 years ago, I was taking care of a patient in the emergency department, and he punched me in the face, causing a traumatic brain injury.
That injury forced Trevor Wolf to give up his nursing career.
We want to provide the best care, but it's hard to care when you're getting beat up and seeing coworkers beat up.
According to the latest statistics from the Bureau of Labor, nurses and healthcare workers are 5 times more likely to be victims of workplace violence. Here at Mercy Hospital, they are working on new efforts to bring those numbers down.
Public safety, is this an emergency? Hold, please.
So we're an emergency dispatch center here at Mercy Hospital Creve Coeur.
Do we have a description?
And this is
Do we have a color?
really where all the information comes in and then dispatched out.
We got an exclusive look inside the dispatch center for the hospital.
Public safety, this is Sarah. Can I help you?
The thousands of panic buttons installed across the hospital system come here.
Broken noses, bloody lips, people kicked, bruised ribs.
The executive director for public safety of the Mercy system has seen it all.
Those aren't the things that our nurses and our doctors sign up for, right? It's not part of the job to be assaulted at work. So we're really helping our clinicians in those situations where there's a violent act, if they would like to press charges, to help them do that.
Brooklyn Snyder was recently charged with assaulting a nurse at Mercy Hospital in Lincoln County, accused of spitting in the nurse's face. But believe it or not, despite the rising violence against hospital workers, charges rarely happen.
The attitude is just brush yourself off, pick yourself up, and then start all over again.
Not only are the attacks rarely reported to police, but News 4 has learned they're often not reported internally at the hospitals.
Anecdotally, we know it's a huge problem, but we don't have the statistics to be able to back it up.
Heidi Lucas is the director for the Missouri Nurses Association. They're working to get more uniform reporting. News 4 reached out to the 3 major hospital systems, Mercy, BJC, and SSM. None of them could provide statistics on how many of their employees were attacked on the job in recent years.
Once organizations put perhaps a violence prevention plan in place, how do we know it's working? Right, if we're not tracking that.
Rampaging patients isn't just a problem in our region. Video from a Minnesota hospital shows a patient attack nurses with a metal bar. A nurse in Boston was stabbed multiple times. And the COVID pandemic only made things worse. While nurses were hailed as heroes, they've now become targets. Laura Kensting has stories.
Not only the physical, the verbal is every day. Verbal abuse, emotional abuse, every single day. I never know when someone's going to pull out a gun.
Mercy's public safety director says they are expanding training and working to add new technology like panic buttons on nurse ID badges.
Can we put in audio AI that detects increases in volume and voice before a fight occurs? Look for phraseology, right? So if somebody is threatening somebody else, it'll send an alert earlier on.
Kensting is taking early retirement. Wolf worries if nothing changes to make nurses safer, the staffing shortages inside our hospitals will only get worse.
This is affecting our healthcare system at its core. It's affecting the ability to fill jobs.
As nurses marched in Washington last week, lawmakers in the Senate introduced a bill that would require violence prevention plans and mandate an established reporting process and prompt response to all workplace attacks.
I do have hope. I see that yes, they are doing a lot, but it's going to take a lot more.
Alexis Zotos, News 4.